Welcome back to the Pause and Effect podcast, where we explore everything you need to know about caring for your pet companions. I'm Dr. Kara, your host and a veterinarian, and today we have a special guest returning to the show. It's Dr. Nicky Hogan. Dr. Nicky is here to share vital information on the importance of vaccination, neutering, and all things you need to know about acquiring a new puppy. As a passionate veterinarian from Hillcrest Veterinary Hospital, Dr. Nicky brings a wealth of knowledge and experience to our discussion. So whether you're a seasoned pet owner or considering adding a new member to your family, this episode is packed with valuable insights to ensure the health and happiness of your canine companions. Let's dive in. Thank you, Dr. Nicky Hogan, for coming back and chatting to us. I was so privileged to speak to you before, and I thought it's time to have you back. There are lots of questions.
Lovely to be back. Thank you for having me.
So I don't know if you've noticed, it's the time of year where we're seeing a lot of puppies.
Yes.
And I love your approach to managing that first puppy consult. I've just got a new dog and it's time to visit the vet. So I want to start off by saying, when should owners be doing this? When should they be coming through our doors for that first puppy consult?
Okay, so it depends on a lot of things. But most puppies we like to see at 6 weeks for their first vaccination. And they can come in earlier. Certainly if they have been, if the owner has bred the puppies, then I recommend they come in from 2 weeks of age to be weighed and dewormed. And that to be done every 2 weeks initially until they come for their vaccinations. But that's kind of a separate situation. But yeah, so 6 weeks is when we generally first see them for their first vaccination. I like to try and take a little bit of extra time with that first consult, mostly because it's very overwhelming for the puppy. They get brought in, there's this place with strange smells and strange noises, and they might encounter a cat for the first time in the waiting room, and they're like, what is going on? So I like to spend a little bit extra time. You know, they get plonked on a table, and then I bring out a stethoscope, and there's a lot of things going on. So I like to kind of try and make friends first. Lots of treats, bribery and corruption works like a bomb. And just take a little bit of time to kind of gain the puppy's trust, because especially behaviorally, the first 16 weeks of a puppy's life are when that's the groundwork, that's the framework for how they approach life for the rest of their lives. So those first couple of visits can sort of dictate how they're going to be for the rest of their lives.
Make or break type situation.
Absolutely. I mean, you don't want to have a 60-kilo Ridgeback who had terrible first visits at the vet and now tries to eat everybody now that they come, now that they're 60 kilos. Yeah. So take a little bit of extra time and then discuss all the various things. So deworming, vaccinations, nutrition, puppy schools, how important puppy socialization is. Obviously only once they're, had several vaccines and are protected to be socializing.
We'll discuss that today, definitely.
Yeah.
So can I ask, as a puppy owner or having had puppies, one of the things I have started to advise is you've just acquired that puppy, come via us. And I tell you why I've set up that as a sort of standard approach, and that's because I've ended up with a puppy with a problem.
Yeah.
And by the time as a owner, not a non-vet owner, would come into us, the whole family are attached.
Yes.
So what are the sort of things that if they say pick up the puppy from the airport or they've just come from the breeder, what are the benefits? What are the kind of things that we can detect at that first visit that ideally before they've bonded, although it's generally, we know, it's generally too late. What are the kind of things that we can pick up?
A lot of congenital conditions that we would look out for. So cleft palate, very narrow nostrils, so nares that we obviously see them a lot in bulldogs and Boston Terriers and all that kind of thing. The flat-faced breeds that really battle to breathe anyway, they often have malformed nostrils, which make things a lot more tricky. Umbilical hernias. which I generally say to people, a lot of people are like, there's a lump under my puppy's tummy. And I normally say to them, look, as long as you can feel it, I say to them, feel it every day, as long as there's no redness or pain or heat or anything, you're fine.
Okay, so just for the listeners, tell us, unpack what is an umbilical hernia.
Okay, so the umbilical hernia is basically where the umbilical cord goes into the puppy when it's inside the placenta, and normally those muscles kind of close over it, and it's done and dusted. But sometimes the muscles don't close over completely, so there's a small hole between the muscles and kind of the skin. So a lot of the time, the intra-abdominal fat or the omentum can come through that hole and kind of sit on the outside. And so often you can reduce that hernia. So sometimes it looks really big, and then you push on it, and then it goes in, and that's fine. So small holes don't generally cause an issue. The only time I would really get twitchy about it is if it's a very large hernia, where theoretically a intestinal loop can come through and twist, and then that becomes an emergency. So if it's a tiny hole, I generally say to people it's mostly aesthetic. It can be fixed when we do things like spays and so on, but as long as you can touch it every day and the puppy's not painful, don't fret about it. Yeah, exactly.
Okay. All right.
So we pick up those. We pick up retained testicles. So
what is a retained testicle?
So the testicles come down from behind, from just below the kidneys, and they migrate down through the inguinal canal into the scrotum. And this is a normal process that happens after birth. And majority of puppies, both testicles come down and everything's fine. In some cases, one will come down and the other one won't. And they can get stuck kind of anywhere along the way. So just behind the kidney or all the way down and sitting in the groin area. So we need to see whether both testicles are there. And often I'll say to people, okay, I can feel one, but I can't feel the other. Let's not panic about it. We'll check it at the next vaccination and the next one and so on. And we just kind of keep an eye on it. Because if it is retained, that does become an issue down the line. So we would always recommend getting those puppies castrated, because we need to go and find the missing testicle. Reason being is anything that's any testicle, particularly that stays intra-abdominally, the body temperature is higher in the abdomen compared to outside, and so those retained testicles are more likely to become cancerous later on in life.
And of course you can't then monitor them because they're inside.
Yeah, because you can't see them. So we would always recommend castration in those cases. Well, pretty much in my case, pretty much all cases.
Yes, and we'll talk about that shortly too. So, take me through a typical examination. So, you've said obviously some of the things you discussed, but I think what a lot of owners don't appreciate, because we're having conversation with them or we're engaging with them, is the process of sort of and obviously different vets have different approaches, but most of us are taught to be thorough and have a systematic approach to examining a pet.
So basically I would start generally at the front end, obviously making some friends first and lots of tickles and loves, but then checking eyes, checking ears, looking at the nostrils, looking at the gums, the palate, looking at the bite, the jaw. Does it have an overshot jaw or an undershot jaw? And then I always feel lymph nodes. They're always bigger in puppies than they are in adult dogs, but we always have a feel anyway. Running hands down, have a feel of the abdomen. We can often feel thickened intestines if they're very packed full of worms. They can sometimes have a sort of a pot-bellied appearance as well, so they can have fluid in the abdomen, which often is worm-related, but it is something we need to know about. A lot of people ask me to look at like hips and things like that. They're sort of panicking about hip dysplasia. And I always say to them, look, I can look now, but they're 6 weeks old and they've kind of just figured out how to walk properly, so they're gangly and
it's normal laxity.
Yeah, exactly. So you can't evaluate them at that age, but you can have a look and make sure that kind of the joints are all kind of facing the right way and all that kind of thing. Yes, aligned, exactly. And then very importantly is listening to the heart. We can pick up congenital heart abnormalities, murmurs, basically any sort of arrhythmias, all that kind of thing. So that's really important. And then listening to the lungs as well, making sure that those sound fine.
Now, I want to stop you because I know what you're going to say next, because I want to unpack this so that people have an understanding. The next thing is obviously you take their temperature. Oh, yes, of course. So what happens if you discover that they have a high temperature?
So basically, we need to make sure that they have a normal temperature in order so that, that they're not fighting something off, so that they're healthy enough to be able to vaccinate. If they do have a high temperature, then if it's not too high, potentially it can be stress. But normally we would do a blood smear. Particularly in this country, we battle a lot with tick bite fever. And I've seen really young puppies with babesia. We also get the longer form of tick bite fever, the lichia, so we need to kind of look for that. And a lot of people sort of always ask me, why do you have to put the thermometer in their bum? Like, why can't you do, the forehead or whatever? And, unfortunately, we need internal body temperature. And, most of our puppies are so hairy that there isn't really anywhere that's not hairy.
That's going to give you a reliable temperature.
Exactly.
Okay.
And interestingly enough, dog and puppy temperatures are much higher than people. So obviously the range for people is sort of 35 to 36.5, whereas for dogs and puppies it's 37.5 up to 39 is kind of considered normal. When we start approaching 39.5, then we do get twitchy.
So why would we not vaccinate with a high temperature?
Well, because they're obviously fighting some infection, and the vaccine itself we're introducing something that their immune system needs to recognize as foreign, that they need to produce antibodies to, and if they're busy doing something else, then that's going to interfere with making enough antibodies to become for that vaccine to be effective.
Before we resume our conversation, let's address a vital aspect to pet care, your puppy's nutrition. Allow me to introduce you to a personal favorite, Ultra Pet's premium recipe for large breed puppies. I've relied on this for all my dogs, and it's truly made a difference. This puppy food offers a balanced blend of nutrients, with 30% protein, 15% fat, and 4% fiber, supporting your companion's growth and development. Featuring a delectable chicken and rice flavor, Ultra Pet caters for even the pickiest eaters. It's available in 2 pack sizes, a 8 kg and a 20 kg, and it's suitable for households of any size. What sets this puppy food apart is its meticulous formulation, developed by experts for a complete and balanced diet. It includes essential vitamins and minerals and prebiotics for a healthy digestive system and a robust immune system. With high-quality protein sources and essential fatty acids, this food promotes muscle development, healthy skin and coat. Plus calcium and phosphorus strengthen bones and teeth. Ultra Pet has mastered the balance between nutrition and taste, making it a top choice for puppy food. Find it at your local pet store and give it to your companion for the best start. Your pet will thank you, and you'll appreciate Ultra Pet's commitment to optimal nutrition. Now, let's get back to our conversation. And what is your advice? I mean, obviously it's dependent on what you're discovering, but what is your advice, particularly from a recommendation of things like insuring puppies and trying to set them up for sort of preventative measures?
At that first consult, I'll always discuss pet insurance, and I'll say to them, read the fine print, make sure that you know what you're paying for. And I will pretty much always tell them, don't go for only accident cover. You need some form of illness cover, because accident cover is great if, you run over your dog or whatever. But if there's something else, if there's illness involved, which a lot of the time, I mean, we do get a lot of trauma cases, but we do get a lot of illness cases. And if you're paying this money every month and it's not going to cover illness, then that doesn't make any sense. Mm-hmm. I mean, we've had a couple of puppies recently the one puppy fell into a hole, not like a major hole, but it was about 1/2 meter deep, and just landed funny and ended up breaking her elbow. And luckily, the owner was responsible and had pet insurance, and so we were able to fix it surgically. So, you don't anticipate having to claim on insurance for a 3-month-old puppy. You always think the drama is going to happen later, but life has a funny way of not working out that way.
And I mean, again, a bit like not going via the vet and discovering it at a later point that your puppy has some very serious congenital or some kind of abnormality. You are in a position where you've taken on ownership. The family love the puppy, and you have to do something.
Yeah.
So I think, being set up before there are any pre-existing conditions.
Yes, because those become tricky with insurance companies.
And obviously we've covered in previous podcast episodes quite a lot on microchipping, but would you suggest at the first or the second thing, because obviously you're trying to establish a bit of a bond and they're not going out, so when would you generally microchip?
It's a little bit tricky. I try and, like, a lot of people come in and like, we want vaccinations, we want deworming, we want microchipping, and great. I'm very glad that they're being very proactive, but in light of what I was saying earlier about trying to make the first 1 or 2 visits the least stressful possible, I try and delay the microchipping. Look, don't get me wrong, every pet needs to be microchipped, but I try and wait until at least the 2nd vaccination or potentially the 3rd, because they shouldn't be going out anyway until they're fully vaccinated. And that needle is big and it hurts. It's over very quickly, but a needle like that, if when they're not expecting it, they can really go, well, this was a nice place until I got that. I don't ever want to be injected again. Yeah, exactly. So I always recommend it, but try and delay it slightly, just so that first visit is mostly about cuddles. And I always have a whole jar of treats in the consult room.
Is that where they all go?
Yes. And I basically just make sure the puppy just gets stuffed full of treats while I'm busy vaccinating, so that they don't even notice what's happening. And most of the time they don't even care. Yeah. So then they're like, and the owner's like, oh, is that it? And I'm like, yeah, done.
Yeah. So there's no need for owners to delay because they're scared of injections. So I wanted to take the opportunity, and I have to sometimes, obviously as vets, we have to bite our tongue and remember our place within the practice. But I will be at a park or the beach, or here, obviously, where we're living, we have the farmer's market. And I will come across the cutest puppy, and it's in arm, generally, though sometimes it's on the floor. And there are so many people who are going past loving this dog. And when I say, well, how old is it? And they say, oh, it's 6 weeks. My heart sinks. And I would like to take the opportunity for us to discuss why, as vets, we really, from a socialization perspective, I appreciate why people do it. Yeah. And so all respect for owners who want to get their puppies used to different environments and situations, but there is truly a high risk. And I want to go into the subject of vaccination and why we recommend that puppies and kittens, but puppies are fully vaccinated before they come into contact with other dogs.
Okay. So most of the vaccinations that we do, we start at 6 weeks. There is a newer vaccine that's come on the market now, which you can start at 4 weeks, which is great. It's called the DP vaccine, so it protects against distemper and parvo. And the really nifty thing about this new vaccine is that it overrides maternal antibodies. And it starts produce. You get antibody production within 3 days of having this vaccination. So the maternal antibody thing, basically, mothers will pass on protective antibodies to their puppies
if they're vaccinated.
Okay.
Or they've come across the condition before.
Exactly.
Okay.
So and that's great because we do want some level of protection, but that's why we vaccinate, is to boost those levels of antibodies, to make sure that the puppies don't get sick. Kind of in a nutshell, how vaccines work is a small portion, like an inactive portion, or the basically just the part that has the antigen on it, is in the vaccine. And so it's not enough of the pathogen to make the puppy sick, but it's got the antigen there, which is the marker, essentially. So that the puppy's immune system, the white blood cells, especially the lymphocytes, know how to make, they know which antibodies to make, and it basically forms like a lock and key mechanism. And then those antibodies are made in certain numbers, but that's not enough. So then we have to boost them, 2 to 4 weeks later, and again to make sure we have high enough antibody levels. And then, so basically, the vaccine produces a small amount of antibodies, which then circulate in the body for a very long time. And then if the puppy gets infected by the real disease, there are already circulating antibodies that start to work on the pathogen and fight the infection. So the vaccine basically preps the immune system, and that's so important. I mean, the two that we're talking about, distemper and parvo, are devastating diseases. And, we really, I think anybody who's treated a parvo puppy will attest to how awful a disease it is. And it's heartbreaking. And, I think what a lot of people don't understand is because it's a virus, if you bring your parvo puppy to us to treat, they don't realize that we do a lot, but it's all symptomatic treatment. There's no antidote. There's no one thing that we can fix.
Yeah, it's not a cure.
Give them. There's no cure. Okay. So basically, what we do with parvo treatment is we put them on fluids and all the anti-nauseas, all the medication to prevent dehydration, because they're obviously vomiting and have bloody diarrhea, and then antibiotics as well to prevent septicemia, because that's generally the two ways that puppies die is dehydration and septicemia. So we buy them time so that their immune systems can fight the virus. And the more vaccinations they've had, the more effective their immune system is at fighting that virus, and the quicker they get over it. But if you've got an unvaccinated puppy that's going to the farmer's market at 6 weeks old, it's a disaster. They've got nothing to fight.
And just in terms of basic transmission, we don't have to go into the whole epidemiology of it, but this is transmitted on surfaces.
Yeah.
Owners, you can't see it. It's not even.
They don't even have to have nose-to-nose contact with another puppy that's got parvo. The scary thing is the parvo virus itself is actually extremely hardy, which is the most frustrating. It can live in the environment. Like I always say to people, you take your puppy to the promenade for a walk on the promenade, and it has a sniff at a spot where a parvo puppy pooped 8 months ago, and it'll get infected. That virus survives for up to a year in the environment.
Which is critical for owners who have had a parvo puppy and have unfortunately lost it. Yeah, and then are replacing that puppy because it is in their environment everywhere.
Yeah.
And so there's obviously, I refer to it as a bit of a washout period where you need to be managing your environment and being very proactive about vaccines going forward before you bring another puppy onto your property.
I basically say to people, if they've lost a puppy to parvo, don't bring another puppy into your house for a year, because it's irresponsible, essentially. Parvo is the big one, the one that we're all sort of very scared of, but distemper is also a nasty disease and can cause all sorts of neurological issues, and we do see it.
So absolutely. I think maybe because it's not necessarily in the population of own pets, people think that distemper is just one of those extra add-on vaccines, but it's a true disease, and we see it
absolutely
in our practice. Fortunately not too frequently, but it's dreadful. So what are some of the symptoms of distemper?
Well, it depends on, they can get two different forms of it initially, or they can get both. So there's a gastrointestinal form, so they could just have diarrhea and vomiting initially. or they can get the respiratory form, so they have mucky eyes, snotty nose, and then both of these can actually progress to a neurological form, which has very broad symptoms. Some of them can survive, but then may have long-term neurological effects, and some of them unfortunately succumb to it. So yeah, it's definitely something you want to vaccinate for.
So this brings me to rabies, because obviously often with the distemper cases, when there are neurological signs, we go, oh, is this a rabies case? And we speak about this because we, in KZN, but South Africa as a whole, have a major problem with rabies. There is an outbreak. It's a true problem, and we recommend yearly vaccination of pets.
So this is where it kind of gets a little bit tricky, because most of the rabies vaccines on the manufacturer's kind of insert say immunity lasts for 3 years. Okay. But that's generally an area where rabies is not endemic. So KZN, unfortunately, is an endemic area, and we have to be a lot more proactive with it. So we definitely recommend yearly vaccinations with rabies. And then, a lot of people are concerned that, do we really need to do the 5-in-1 every year as well? And look, theoretically, most of the manufacturers do recommend yearly vaccinations, but theoretically, a lot of the components of the vaccine, the immunity will last for 3 years as well. The tricky part comes in is, for want of a better word, policing that. At least if you know that your animal has to come in once a year for vaccinations, a lot of people will be like, oh, I must go, and then life gets in the way. It's a health check
as well.
Yeah, which is a health check. Life gets in the way, and then before you know it, it's 6 months, it's 18 months since their last vaccination, and then before you know it, it's 2 years. So if you tell them every year, and they're a little bit late, it's not the end of the world. But if you tell them to come every 3 years, and then they forget about it, and then they come every 5 years, then that animal has not enough protection. And on the rabies topic, a lot of people are like, oh, well, my dog never leaves my yard. Why do I need to vaccinate it for rabies? And yeah, I'd launch into a whole tirade. But there have been incidences of stray dogs getting into complexes and up and down streets and fighting with dogs through fences.
And this is not made up.
No,
we've had these scenarios
exactly
very close to home.
And Westville and upper highway area. So, it does happen. So even if they don't leave the yard, they need to be vaccinated every year.
And I can attest to, I'll go, I put tick and flea treatment on the dogs. I'll remember it was the first of the month, and before I know it, it's overdue. And it's the same, lives are busy. It's not necessary that people don't have the intention to keep up with things. It's just,
stuff gets in the way.
Yeah. When we do try and make a point of reminding people every year with our
vaccination reminders.
Yes.
Yeah, absolutely.
So particularly, and especially if you want to keep a passport. So I think, we can go into that in a different, I'm sure I'll have you back as a guest, because I know that you do a lot of passport work in terms of this is for dogs.
Exporting, going
to abroad.
Yeah.
And so they're very strict about keeping the timing. And we've had broken hearts and
untold drama
when people forget to keep their vaccines up to date. But let's go back to, you made mention of the deworming. So you're seeing these puppies, and let's assume most breeders are very conscientious, and they've dewormed the puppies before they get to their owners. But in terms of deworming protocols, explain why we need to deworm, because most people say to me, "Oh, but why would my
brand new puppy?
Why would my puppy
how would it have worms?"
Yes.
Okay, so it's a little bit complicated. It's involving the life cycle of the worm. The one that I like to focus on is hookworm, because that has a massive negative impact on the health of the puppy. So the hookworm is different to other worms in that it gets its nutrition from feeding on the host. So they attach to the inside of the intestinal wall and they suck blood from the host. And that's a big issue. You know, you've got a little puppy who's got lots of growing to do, and I mean, growth is a very energy high, it has a high energy requirement. And so now you're trying to let them grow, but they've got all these little vampires on board that are making it difficult. So the whole life cycle of the hookworm, there's various stages. Most of it happens in the intestine, but then the eggs get passed through the feces, and then they'll hatch into various larval stages, which eventually complete the life cycle either when the dog truffles in the grass for something and gets the larva stage there, or eats a lizard that is like the intermediate host, and then it goes through the whole cycle. But what often happens is the life cycle needs to be finished or completed in the intestines, but some of the larvae get lost along the way and they migrate into various tissues, and then they become dormant. They go into like an inactive stage. And a female will often have lots of these dormant, inactive larvae throughout her body in various tissues. And then along came the pregnancy hormones, and that's like a massive wake-up call to these little larvae, and then they wake up and start migrating. But then instead of trying to find their way back to the intestine, they migrate to the puppy. So they go through the placenta and infect the puppies that way, and they also migrate to the mammary glands. So they get transmitted through the milk.
So 2 opportunities for your puppy to pick up.
Yeah. So all puppies are born with worms, which is surprising to a lot of people. And we really need to be vigilant about getting on top of that deworming schedule right from the beginning. I've lost puppies to severe anemia because they've just been sucked dry, essentially.
So anemia, just for clarification for the listeners.
So basically their red cell count is so low because the the parasites have eaten all of it. And you need your red blood cells for oxygenation and basically making sure that the body functions as it should. So
these puppies typically present with, you were saying, the pot belly,
yes,
the vomiting, diarrhea.
Yes, often vomiting, and I say, especially in that first consult, if I feel those intestines don't feel kosher, I'll say to the owner, look, here's the deworming schedule. Don't be alarmed if you see like spaghetti coming out of your puppy's bum, because rather out than in.
Absolutely. And I think when people see them out, they delighted that they've actually been proactive about doing it. Now, I don't want to lose the opportunity to tackle another subject that I think is really critical, and I've received quite a few queries about, and that is new puppies and the advice that vets give on neutering, on spaying or castrating. So just so that I don't miss this opportunity, because I know that we both have opinions, but informed opinions, yes, about this subject. And I think it would be good to share that, whether it's well received or not. So let's start with a female. So you've got a bitch, and the owners are saying, when do I see you to have her spayed?
A lot depends on the breed. Less so in females. The sort of the accepted general consensus at the moment is because females have a much higher incidence of mammary tumors later on in life, the earlier you spay them, the better. And a lot of people are a little bit twitchy about this because they say, yeah, but I spayed my last bitch really early and then she was incontinent. And that is a thing. Between like 5 and 20% of females will become incontinent after spaying. But I kind of always counter that with incontinence is a lot easier and a lot less drama to treat than cancer.
And it's manageable. It is manageable.
It is manageable.
We know that we
medications.
can medicate in order
absolutely.
to.
So that's kind of the one concern. And then one thing to note with the uterus of a bitch is quite different in that each cycle that she has, each estrus that she has, the lining of the uterus changes. Okay, and they are much more prone to developing something called pyometra, which, as you know, we've done countless of those over the years. Basically, the bitch sits with a bag full of pus in her system, and that can either be an open pyometra where you can actually see the pus coming out of the vulva.
So the cervix is open, which allows visualization of that.
So the pus comes out.
Much easier to diagnose.
Easier to diagnose and better prognosis because, you can kind of catch on to it quicker. The closed cervix pyometras are the real worry. In fact, I did one a week ago where, they're just unwell and you have to go and find out what's going on.
So sickness, just my dog's not well.
Yeah. And basically that just poisons the system and they can become septicemic and die. So it's a lot easier to spay a healthy animal than to essentially spay an animal who's compromised because they're sitting with a bag full of pus inside them. So I generally say to people, small and medium breed dogs, just spay them kind of 6 months.
Unless you're seeing that, they're typically the dogs that when you go in and they greet you, they urinate all the time, in which case you might say, based on circumstances, like
yes,
there isn't an intact male, there isn't a risk of her becoming pregnant, you may want to take this into account, that it's going to potentially increase the possibility of a mammary tumor.
Yeah.
However, so you allow people to make an informed decision, but
exactly,
to know the pros and cons.
Exactly.
Okay.
Small and medium breed males, same story. You castrate them early.
And there's no incontinence risk with males,
no,
by the way, to make a point.
Yeah, so the incontinence thing, obviously, as we know, is a estrogen-based thing. So the estrogen is necessary to maintain that bladder sphincter. And if we take away the main source of estrogen, then sometimes they do become incontinent. So obviously that's not an issue with males. The sort of the hotly contested topic, I think, really is the large and giant breed dogs. Mostly because, it's kind of separated into two groups: the musculoskeletal conditions, things like hip dysplasia and cranial cruciate ligament rupture, and then the cancers. So I think you've got to kind of, yes, there have been studies, but you have to kind of look at where those studies have come from and what kind of dogs are involved. Because a lot of them will be purebred dogs who are known for having hip dysplasia, golden retrievers, rotties, etc. So you've got to kind of take that into account. And also, a lot of these studies are retrospective. So they look at stuff, it looks at data, looks back at data. So stuff that has already happened, but it doesn't take into account genetics and environment and nutrition and, weight gain in the first year of life and how important that is for things like hip dysplasia. So, currently the thinking is to try and delay, certainly from the male perspective, castration until they are skeletally mature, which would be sort of 15, 18 months for the large and giant breeds. The reason being is when you remove the testicles, you cause delayed growth plate closure, which then kind of changes the shape of things like the pelvis and so on, which can lead to increased incidence of hip dysplasia. So there's no hard and fast rule.
Yeah. So, if you, for example, get a dog that is displaying some potentially hormonally obvious behavioral issues, So one of the recommendations would be to consider to castrate earlier rather than later.
Yes.
Because, I mean, it's known that obviously, testosterone
fuels the fire.
Fuels the fire, yes.
Yeah,
and
absolutely.
it can make a difference. And rather than setting up a situation where it's just a vicious cycle and you have a dog that is either euthanized or rehomed, that, there's a bigger picture here.
Yeah, for sure. So yeah, it's a hotly debated topic, and I actually was reading an article yesterday and made a very good point. I mean, it's totally off topic, but you can't take incidence, so how often something occurs, as a measure, that there's a direct correlation. So, for example, they said the number of people who are becoming diabetic has increased, and the number of people who are doing yoga has increased. It doesn't mean that doing yoga is going to make you a diabetic, or that all diabetics are going to want to do yoga. Do you know what I mean? Like, there isn't necessarily a link between the two, and you've got to be careful not to extrapolate too much. But, males, large and giant breed, try and wait until they're skeletally mature. The cancer side of thing, that's kind of a little bit fuzzier as well, because, the pure breeds, I mean, we all look at a boxer and go, oh, they're such awesome dogs, but they're like walking tumors. Like, I mean, if you see a boxer that's over the age of 7, there's a tumor somewhere.
Sure.
Terrible, but that's how we think. And so you can't necessarily say that the two are related. Do you know what I mean? So a lot of the time, people going to referral centers for osteosarcomas, so bone tumors, or transitional sarcomas, transitional cell carcinomas, bladder tumors, they will be purebred dogs, which may have had a predisposition to cancer anyway.
Yeah.
So, it's not very clear.
But just to make mention, so the cancers that we see in uncastrated dogs are both testicular tumors as well as prostate. And again, we can go into this in a future podcast episode, because I know that this is another rabbit hole we're going down. But, males will get an enlarged prostate, and it may be benign, but you may also have it be a cancerous change, which is devastating. And also then trying to manage it as an older dog means that you haven't got necessarily age on your side in terms of anesthetic risks and whatnot.
Yes, and all sort of comorbidities. And so.
Exactly. So what we're ultimately saying is have a discussion with your vet. Don't Google, but make an informed decision, and understand that there isn't a perfect, but we are in a position now where we can make recommendations based on what we're seeing in practice, including why to vaccinate or why to castrate, and those sort of measures can set your puppy up for
absolutely
a
long and happy, healthy life.
Which is what we all want. We want our pets with us for as long as possible. I mean, taking the opportunity, obviously, from a nutritional perspective, for me, the critical time to consider really good nutrition is when they're puppies. Like you were saying, this is a period of time where there's
massive
growth, and you don't want any nutritional issues. You don't want any deficiencies or excesses. I think people don't appreciate that you can actually, an excess of something can actually be just as damaging
as a deficiency.
And I mean, when they have got parasite load, or they are mounting immune responses because they're coming across different things, to have good nutrition on board will set them up.
Vital. Yeah,
absolutely. So I mean, it's very much a holistic approach you take to your consultations in terms of, are people overwhelmed? Are they?
I think sometimes you sort of get that deer in headlights look. And then I'll often say to them, look, go and have a think. And if you have any questions, obviously just give me a ring and we can discuss anything that you have, questions about. But, there are good resources on the internet, not all of them. But, I think it's a kind of a double-edged sword, the whole Google thing, because, it's great to have clients who want to know more. but they have to be looking at in the right places.
There's a lot of misinformation out there.
Yeah, and that's the scary
frightening.
thing. Yeah, it really is.
And very dangerous advice.
Yeah.
That one mistake can obviously lead to a whole host of long-term problems. So in terms of the great thing, like you say, even if people are initially quite overwhelmed, is they get to see you again because there's a follow-up appointment.
Exactly.
And that generally is 3-4 weeks after the first one. Is that correct?
So we would normally do sort of 6 weeks, 9 weeks, 12 weeks. But it depends. Some people only bring in the puppy in at 8 weeks, and then everything gets pushed back. If they do come in at 8 weeks for their first vaccination, then at their second vaccination they can get their first rabies vaccine. We wait until 12 weeks generally for rabies vaccination, just because maternal antibodies will interfere with the puppy mounting its own rabies antibodies. The one place where I don't necessarily take too much stock into that is if the puppy comes from an unknown area or the circumstances, the background are unknown, because we don't know if the mother was ever vaccinated, so there may not be any maternal antibodies, in which case I normally say to people, look, we might be being overly cautious, but let's do the first vaccination of rabies now at 8 weeks. It just means that we have to do, instead of doing 2, we do 3.
Yeah.
So it just gives them that kind of protection in case the background is sketchy. And, a lot of people adopt puppies. Some people get puppies from
rescues.
Rescue centres, or even like pavilion robots. You'll pick up some puppies or whatever. And you don't know where they come from. So, try and protect them as best as you can, even if we have to do an extra one at the end of it. It's not the end of the world.
And we're talking about the ones that are taken from the robots. Obviously, they're high risk of things like parvovirus or everything. We also see like major skin issues like demodex, mange, and tick and flea issues. So just again, I know we have to wrap up because Nicky and I can talk for hours.
Jabber forever.
We love this. Let's have a quick summary of the tick and flea measures and why people need to be proactive about that, on top of obviously the deworming.
So most obviously with tick and flea stuff, obviously you don't want any fleas on the puppy, apart from the irritation. They do suck blood, so there can be a serious anemia or lack of red blood cells from that. The ticks transmit various pathogens, various diseases. So the 2 types of tick bite fever, that's super important. And a lot of the newer tick and flea things actually have mite coverage. And I must admit, I definitely see a lot less demodex cases now than I did 10, 15 years ago. Much less. We're sort of being so much more proactive about it. It's different in a welfare situation, or with stray animals or whatever. You will still get that demodex, but in terms of owned puppies coming in with responsible owners, we hardly ever see it now. And there's so many products that are effective against the demodex, and it's great because you can have what we call localized mange, which is super easy to treat, but you can also get generalized demodectic mange, which has long, you have to treat for much longer, and there's lots of potential
bacterial infections.
And secondary dramas, and you sometimes can't get rid of it completely, and so that becomes a major issue. When I took on my 2 puppies a very long time ago, they were brought into the practice I was at the time. They'd been found by these boys dumped at a river. They were 2 weeks old, probably, had their eyes open. And that was pre-Bravecto, NexGuard, all that stuff. And so I had to, and they got demodectic mange. I had to do the whole bathing and dipping thing once a week, and then the oral ivermectin, and
it's miserable.
Just such a mission. And it's so much easier now with these newer products.
Lucky.
Yeah, absolutely.
So my final question to you: your puppy is with you, and obviously they're getting used to your new environment. What are some of the signs of illness that owners need to be proactive about, particularly because they don't have the reserves potentially that an adult dog has, and they seem to deteriorate very quickly. So what are the common, when we get the phone calls and we say to our receptionists, like, when you hear this, you advise they come in and see us. But can I take the opportunity just for you to
Well, mostly appetite is a big one. So if you've got your puppy and you've had it for a week, and as soon as it's walked in the door, it's eating like a gannet, and it's been like that the whole time. And then today it didn't want to eat its breakfast, and then it didn't want to eat its lunch. Then you start getting twitchy. So anything that's kind of out of the norm for the puppy. So definitely lack of appetite. Vomiting is a big issue, both from a disease perspective, parvo, distemper, etc., corona, rota, the whole caboodle, but also from the perspective of, have they swallowed a marble or something, and it's got
puppies
stuck.
Are destructive.
Yes.
Have a habit of ingesting things they shouldn't.
So vomiting is an issue, diarrhea is an issue, and then just general lethargy. Like if they've been a happy, bouncy puppy. Look, there's a difference between racing around like a Fruit Loop and then being so exhausted and collapsing on the couch.
They need sleep.
Yes.
And so sleep is okay.
But if there's no running around and no playing, and they're just sleeping all the time, that's a really big worry. People don't generally pick up fevers because you can't breathe. I mean, they're so covered in hair, you can't really feel. Sometimes you can feel if their ears are a bit hot, but generally you can't pick that up.
And we never discourage owners coming in and saying, I think my dog's not well. We'd rather have a situation where we go, oh no, they're fine, have a good day, than have a situation where people go like, I just had this feeling they were not well. I thought they were a bit hot, but I didn't want to. I thought that I was being neurotic. We don't mind neurotic owners.
Oh yeah,
we'd rather be proactive.
Check, yeah, and just a side note to make about the really tiny puppies, like the toy breeds. Your tiny Yorkies that come in, they're not even a kilo. They're not great at regulating their blood sugar. So if they don't eat very frequently, that blood sugar can drop dangerously low. I mean, we've treated countless in the hospital with hypoglycemia, and we have to put them on a drip, and trying to find a vein in a 700-gram Yorkie is tricky at the best time. Yeah, dehydrated at the best of times. So that's tricky. But there's a whole, apart from the glucose, the food that you get, the glucose you get from your food, the liver is responsible, as an organ responsible for regulating blood sugar by having glucose stores. And these tiny little puppies, their livers just aren't up to the task. And so they have to eat really frequently. Otherwise, they just get hypoglycemic. So especially with the teeny tiny ones, I'd be even more vigilant than with, say, a Labrador puppy or something.
And a good quality veterinary grade diet fed over the course of the day, not just 2 meals, is obviously our advice.
I don't switch to 2 meals a day until they're at least 4.5 months, maybe 5 months. I still stick, and the younger they are, the more meals, 4 meals a day, and then eventually from 3 months they still should really be on 3 meals a day.
And I'm going to take the opportunity to say how important it is to feed according to the recommendations. I mean, obviously, we're very used to, in puppies, they carry a little bit of extra fat and whatnot, but in later stages, we are doing body condition scores all the time. And the concern is obviously with overfeeding is that soft tissue and fat develops faster than the development of the skeletal system.
And overloads those joints.
Absolutely. And that's often which predisposes them to conditions like hip dysplasia and elbow issues. So good quality diet fed appropriately to the right amount, and a consideration of the number of treats that you're adding into that when you are then going through the training. So I would say only 10% of the total daily intake should be attributed to treats.
Absolutely.
So that their nutrition...
And to kind of focus on how important the nutrition aspect is in things like hip dysplasia. I mean, you could take a Labrador who comes from parents that have been graded and they've got great hips, and that first year of life, if they get too heavy too quickly, they can still get hip dysplasia even though the genetics are good. So the environmental factors really need to be taken into account. So I always say to people, make sure they don't put on weight too quickly. And then secondly, exercise must be built up. So don't go from lolling around on the couch to a 5K run. It's got to be built up gradually to build those muscles and give those joints time to adapt.
And develop.
Yeah, exactly.
Thank you. This has been really interesting, hopefully really informative for our listeners, particularly those who have just acquired a new puppy or plan to. And we are very happy to take questions, happy to answer anything that we haven't covered.
Yes.
But yeah, thank you, Dr. Nicky. It's been a great opportunity.
Thank you for having me again.
As we conclude another informative episode of the Pause and Effect podcast, I want to extend a heartfelt thank you to our guest speaker, Dr. Nicky Hogan, for sharing her expertise on the importance of that first vet visit with a new puppy, including a discussion on vaccination, neutering, and preventative healthcare measures owners need to take into consideration. Remember, being a responsible pet owner means staying informed and proactive about your pet companion's health. If you found today's discussion helpful, be sure to share it with fellow pet lovers and leave your comments below. And don't forget to follow us for more insightful information and conversations about pet care. Together, let's create a community dedicated to the well-being of our beloved companions. Until next time, give your pets a massive hug from me and enjoy the amazing opportunity to raise a puppy. This is Dr. Cara signing off. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drcara@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.